Hello and welcome to World in 5. Government has already started mobilizing resources to construct more mini interchanges on road junctions across the country. This was revealed by Transport and Infrastructure Development Minister Felix Mona during a question and answer session at the post-cabinet media briefing.
We are happy, and if you look at this interchange, it's a corridor approach, and we were then directed by His Excellency that we are not stopping there, where already those who are using that road, you would relate that close to Rothmans, Willowville, Simon Mazoro Junction, we are already starting a great separation, which is a mini interchange, and concurrently at the ZBC. So this is something that will be happening now as we speak. But we are now going to mirror is the entire Great Harare, where already as I speak, we've started mobilizing at Mavuku Junction. We are mobilizing on site, where we are going to be have great separation again, and those who are actually going to airport will be accessing the airport right from the junction. Those to the great city will also be accessing from that same platform. And also the Jaggers, which was known as Jaggers before, the Mutare Road and Harare Drive, where we are also going to be having a mini interchange.
The SADC region is considering adopting new strategies to improve intra-regional trade. The bloc noted that trade within SADC member states only consists of 19%. SADC senior officials will be presenting key solutions set to boost trade to ministers responsible for trade on Thursday.
When we looked at the figures of intra-African trade and intra-SADC trade, we realized that SADC trades 81% with other countries and other regions, but only 19% intra-SADC trade, which is a matter that we have to address, especially considering the turbulences that are in the world now. And also, if we are comparing ourselves to what other regions are doing, we are lagging behind the SADC. And we also interrogated the issues that have led to that low level of trading. And these are the issues that we've identified and tried to find solutions to, so that we will recommend to the ministers who are going to meet on the 5th, the Ministerial Trade Committee. They are going to meet on the 5th to adopt the recommendations that we discussed yesterday.
And now moving on to another story. The owner of the pit bull that mauled a man in Bluffhill on Sunday has been remanded in custody after the state opposed bail. Mike Mupinga was not asked to plead when he appeared before Magistrate Marewanajo Gofa, charged with culpable homicide. Gofa is expected to hand down the bail ruling on Friday, and allegations are that on May 31, Mupinga, the owner of 3 pit bulls and a Rottweiler, went to bed and negligently left the dogs roaming around his yard, which is secured by a short perimeter wall. The vicious dogs then scaled over the perimeter wall and attacked the now deceased Samuel Machara, who was walking along the nearby street. There has been a public outcry on Mupinga's charge, with calls for him to be charged with murder. Our correspondent Shikomborero Parafini spoke to legal practitioner Moffat Makuvatsine, who explained the circumstances.
We have this situation of a person who was beaten by dogs, and you find that the person appeared in court today facing culpable homicide charges. And the issue is, some people have the view that he should have been charged with murder, but you find that murder in terms of the law constitutes a crime of intention. That is where a person should have harbored the intention to kill another and goes on to implement the action of killing that person, which results in the death of a person. Culpable homicide is the negligent act of a person which results in the death of another. Now, in the present case, you will find that dogs are said to have caused the death of the person, but we have a difficult situation in the fact that what was seen was a dead person who had been beaten by dogs. But there is no person as of yet who has come forward to say, I saw this person alive, and the dogs started beating this person when I was there. And this raises a question of what we call the cause of death. Was the cause of death because of the dogs, or maybe the person was dead well before the dogs arrived.
Now, in a significant move to expand healthcare access for Zimbabweans living abroad, WorldIn5 Medical Aid Scheme has launched a cross-border medical aid plan tailored specifically for Zimbabweans living in the diaspora, starting with Botswana and South Africa. This move, announced in Harare, marks a groundbreaking initiative by a wholly Zimbabwean-owned medical aid provider to address the growing healthcare concerns of millions living outside the country. And with the rising cost of healthcare and limited access for many in the region, the launch has been hailed as a timely and transformative innovation. WorldIn5 Chairman Maxwell Revai says it is a borderless healthcare solution in which one can access healthcare in Zimbabwe, Botswana, and South Africa.
This initiative is not just about expanding our footprint. It reflects our determination to enhance healthcare, the healthcare accessibility we want it for all Zimbabweans, no matter where they reside. This partnership not only enhances our service delivery, but it also ensures that we are strategically positioned to address the healthcare challenges faced by our members in these regions. When you look at the statistics, you will see that we are not yet there. The numbers are not yet pleasing, but we should be grateful for these milestones and we should celebrate these milestones.
An official from the United Nations World Food Programme, WFP, has warned that refugees in Kenya are facing heightened hunger risks as critical funding shortfalls force the agency to reduce food aid to its lowest levels. The WFP urgently requires $44 million to provide full rations and restore cash assistance for 720,000 refugees through August. And without additional funds, in-kind food rations are expected to be cut to just 28% of daily needs in June, and all cash assistance will be suspended.
But we've seen over time a reduction in donor interest. The real crisis this year was a severe reduction in the food aid of USAID, and we all know that story of the United States, and they were the largest donor. Up to 70% of that food basket came from the United States. So this has had a severe impact, and then several other donors followed suit. And we already have severe cases of malnutrition in Kakuma, but the number of those cases will increase incredibly.
And that's all we had for you on WorldIn5.